Good morning everyone. I am Nandan Tudore. Today I will discuss about uterine cancer. I will explain about uterine cancer introduction and definition. Uterine cancer, most commonly endometrial cancer, started in the uterine lining. Uterine lining, it means endometrium, due to abnormal cells growth often linked to estrogen, and it is the most frequent gynecological cancer, especially in postmenopausal women. Secondly, I will discuss about the types of uterine cancer. There are two types of uterine cancer. First is endometrium cancer. First is endometrium cancer. Endometrium cancer most commonly started in the endometrial lining. Second is uterine sarcoma. Uterine sarcoma is a rare type of cancer. Begins in the uterine muscles. It means myometrium or connective tissue. Causes of uterine cancer. Causes of uterine cancer: firstly, hormonal factors, high estrogen levels, and age is below below 50 years of ages, and obesity, high body fat, increased estrogen, genetically होता है, family history, diabetes, any bleeding after menopause, prior pelvic radiations. And second is the clinical manifestation. Clinical manifestation: first is abnormal vaginal bleeding, pelvic pain, normal bleeding, unusual bleeding, pain during intercourse, unexplained weight loss, change in bowel and urinary habits, painful or difficulty urination, back pain. Diagnostic evaluation: first diagnostic evaluation is pelvic examination. Pelvic examination to visual inspect internal pelvic organs and to feel the size and position of the uterus and ovaries. And next is pap smear. Smear is also to be done to brush the side of the cervical to collect cells for testing and to look the under microscope. And next is transvaginal ultrasound. Ultrasound is similar to USG. It is also often performed to look for tumors. Hysteroscopy is allowed to do visual examination for full endometrium of uterus. And next is biopsy. Biopsy testing is small cut pieces in endometrium layer and visualize. And next is CT scan and MRI. And next I will explain about management of uterine cancer. So most women with endometrial cancer need surgery. Your particular treatment plan depend on your type of cancer and depth of cancer and degree of cancer. Then following types of treatment I will explain. And first type is chemotherapy. Chemotherapy is a powerful drug to destroy cancer cells, and many more medicines I will give in chemotherapy. And second is radiation therapy. Radiation therapy send treated radiation beams to destroy cancer cells. And third is hormone therapy. Hormonal therapy is given to multiple types of hormone to treat the cancer cells. And next is immunotherapy. Immunotherapy, which means help to your immune systems fight against cancer. And third is target therapy. Target therapy, which means use medications to treat specific cancer cells to stop them from multiplying. And continue research study more way to treat it. Endometrium cancer is continue.